Once the urine has been formed, we then have to understand how we get this out of the body. So with the normal anatomy, we have our kidney on either side, and then we have the bladder, which is ultimately where the urine is going to lead to be stored temporarily before excreting. There are tubes which are connecting the kidney to the bladder, and these are called ureters. We then have our bladder proper, and then we have the urethra, which will be the passageway from the bladder to the outside of the body. Now, the bladder itself is a large, smooth muscle, and the muscle is called the detrusor or detrusor muscle. We have some additional muscles that are associated with this process, and one is a circular group of smooth muscles, and these are called the internal urethral sphincter. So we'll see this term sphincter used for muscles that are surrounding a structure such that they will, when they contract, they tend to block off that opening, and when they relax, they open that opening. So we have the internal urethral sphincter, which is also a smooth muscle, and we have at the very end here, we have what's called the external urethral sphincter, and this is a skeletal muscle. So with the detrusor muscle, with it being a smooth muscle, it must be innervated by one of the autonomic branches of the nervous system, and it is innervated by parasympathetic nerves. The internal urethral sphincter, also a smooth muscle, it is innervated by the sympathetic nervous system. And then our external urethral sphincter, with it being a skeletal muscle, it's going to be innervated by a somatic motor neuron. So what's happening with these various nerves and muscles during the process of the bladder filling with urine? So as urine comes down, it's going to be temporarily stored in the bladder. So the way we allow this to happen, so while the bladder is filling, we want the parasympathetics to not be firing. So that's going to allow that muscle to relax and to accommodate the urine that's filling it up. While the bladder is filling, we do not want urine to be able to leave the bladder. So we want the internal urethral sphincter to be contracted. So during filling of the bladder, sympathetics are firing, causing the internal sphincter to be contracted. Now, as a extra safety to make sure that we do not let urine out, we have control of our external urethral sphincter by a somatic motor neuron, and so that can also be stimulated to help prevent urine from leaving. Now, as long as we're not feeling a great deal of pressure in our bladder, then the external urethral sphincter does not need to be contracted, because the internal urethral sphincter will keep urine from leaving. But in those situations where the bladder is very full and it is really putting a lot of pressure on this internal sphincter and trying to open, that's when we may need to contract our external urethral sphincter to prevent from emptying our bladder in inappropriate places. The emptying of the bladder, the medical term for that is called micturition. So in order for micturition to occur, we're going to need the detrusor muscle to be contracting. That's a way that we can increase pressure to help get that urine out. So during micturition, we're going to be stimulating the parasympathetics. We want the urine to be able to leave, so we do not want to be stimulating the sympathetics. So we'll turn those down. Again, if we're trying to empty our bladder, we do not want our external urethral sphincter to be firing either. So we're not going to be stimulating that somatic motor neuron to our external urethral sphincter.